What exactly is bullying?
It's taking those subjective things for the purpose of tearing someone apart and not building them back up.
If you don't say nothing, this going to continue or it's going to get worse. If you say something, it's going to get worse, but you might get your respect. Talk us through that, yo.
I think you should always say something. And I'm going to give an example. So I had a friend who was an ENT surgeon. She was from Puerto Rico, and they started making some comment about her being Mexican. And at first, she kind of went with it. That followed her all 5 years. She hated it.
Damn.
Come on, little Mexican ENT, ha, ha, ha. And she's like,
Yeah, that's a common thing. People will joke around someone being Puerto Rican versus Mexican versus, yeah.
Exactly. And it was a slight. So that's an example of when you don't address it. You should never not address it.
All right, what's good, everyone? Welcome to another episode of Docs Outside the Box. It's your boy, Dr. Nee. Listen, we got a special guest in the building or virtually. We got Dr. Lattisha Bilbrew. What's good? How you doing? Welcome to the show.
Good. Thank you. Thank you for having me.
Yo, so everyone, Dr. Bilbrew is an orthopedic surgeon, badass, but she's also decided to get some additional training, and she is specializing primarily in hand. What's the whole full thing? I say hand surgery, but like, how do you like officially say it?
I say hand and upper extremity because I do fingertip to shoulder. So, yeah.
So for all those trauma patients on 4th of July, when they like hold on to the M80s too long, she's your woman. She's the one who's going to take care of you when it goes boof, right?
Exactly.
But that's a crazy, crazy job, very busy job. I work with surgeons just like you I pretty much say on a daily basis. But also you handle just common, orthopedic hand issues on a daily basis. So it's not just trauma. It's a whole bunch of different things. So for the med students listening, for the residents listening, and they don't know what hand surgery is, go ahead and let them know what you do.
Absolutely. So like I said, fingertip to shoulder. The non-trauma stuff is going to be your everyday things, carpal tunnel, trigger fingers, any kind of tendonitis. I do a lot of sports related injuries too, for those wrist sprains, finger sprains, going all the way to trauma, from the basic wrist fractures all the way to the complex elbow dislocations. And then I also dabble, of course, in microsurgery. So I'm the person that if, somebody cuts the nerves to the hand, I'm going to be putting the nerves back together, or comes in with a fingertip that's been cut off, or a gunshot wound to the hand, or like you said, firecrackers to the hand. I'll be the one reconstructing the upper extremity.
Yo, she a unicorn, y'all. I'm telling you. Yo, we are blessed to have you on this show, Dr. Bilbrew. So thank you so much. So in a second, I'm gonna let you do more of an intro of yourself, but like I want to get the audience like really like listening to why we are here today. So listen, like, right now we're recording this late in March, which means that everybody is matching, and at least right now, tomorrow or Friday, people will find out exactly what residencies they're going to be going to, right? They found out they matched earlier in the week, and then they're going to be finding out exactly where they're going to. And if you haven't matched and you're listening to this, I feel for you, but listen, you still going to make it.
We'll make it.
But you're going to see this all through social media. People are going to be excited. People are going to be disappointed. And people are just going to be just excited to be moving on to the next stage of their training, right? Going into residency, which is a big deal. You get the MD or you get the DO after your name, and you're practicing, learning how to be a doctor in essence, right? Which is a big jump from med school. But, one of the things that we rarely talk about on this show, but you actually see a lot of on social media, hella on Reddit, is bullying in residency. And this is something that, we see it on social media, but we don't really get a chance to like talk about like how do we like identify it and how do we get through it. So let's talk about that. That's what we're going to talk about in this episode, is like what happens, when all the glitz and the naivete goes away and you find out that you're being pushed around in residency. How do you handle that? Right. And Dr. Bilbrew is our expert on this, who's going to talk about this. But before we jump into that, let's talk about some quick stats. I got some notes and I feel like an old man. I got to make my screen bigger. But here's some quick stats on bullying in medical training. Studies show that up to 48% of residents experience some type of mistreatment during training. Right. That's a big deal. Almost close to half of all residents in training experience this. Right. There's definitely gender differences. Female residents report experiencing significantly more bullying than their male counterparts. Right. If you're an international medical grad, I didn't even think about this. If your primary language isn't English, oh, yeah, you about to get bullied. You likely are going to get bullied on this, right? And here are some of the consequences of all of that, right? Of being bullied. Some of the consequences are residents are reporting feelings of burnout. We talk about 57% due to being bullied. Worsened performance, 39% due to being bullied. And also depression. And you know, folks, in medicine, we got a suicide issue, right?
Right.
So
Exactly.
this is a big deal, Dr. Bilbrew. This is a big deal. So the way how, man, we can go in so many different directions with this. But in your opinion, like what exactly is bullying? Did you experience bullying in your training at all?
Yeah, so I think we all know what bullying is. It's taking those subjective things for the purpose of tearing someone apart and not building them back up, right? The person that is doing the bullying, they want to make the other person feel small, inferior, less than. They want them to doubt themselves. And did I experience bullying? Absolutely.
Hmm.
Day one. And I think that comes with, you mentioned those stats. And I think if we were to focus again on the women, and then, for me, I was a Black woman in a white male dominated field. I was the second Black female at my program in the history of the program, the oldest orthopedic surgery training program in the state at the time. And my first day, it was general surgery. And I remember the chief resident was like, "Oh, Lattisha Latoya, my last name was Rowe at the time. Rowe, you bet not give me no trouble, girlfriend." And like this exaggerated urban, and I was so confused because I'm like,
How do
wait,
you respond?
right? And people are laughing, and I've never been ashamed of my name. Like I still spell my name fully out. So I was like, oh, he's making fun of me. Like he's making fun of like the fact that I have a very ethnic name. And, I was coming from Atlanta where at Morehouse, half of the class is named Isha, Isha. So,
Yeah, it's very
I,
common for you and stuff.
so
Yeah, yeah,
common.
yeah,
So
yeah.
it took me literally minutes into the conversation to be like, what was that about? He's making fun of me. So how do you handle that? Like I always tell my mentees, you don't have, unless you super, like I'm super quick now, but I've had 15 years to
Mhm.
gather that quickness.
Right.
You always just take the time and pause. Never come back initially, even if you have the mouth and that vernacular with the four-letter words to jump back. I always say just pause and digest it, right? And that could even mean for a day or two. Understanding
Mm.
that you're not using that information to be like, man, I got a terrible name, or whatever the negative information. It's always negative. It doesn't reflect on you, but reflects on what caused that person to say that. And I realized it's because he had never worked with a Black female intern ever. Right, like this was his. Sorry, there was one more before me, but this was like his first experience in his chief role, and so understanding that dynamic helped me to shift the reason why the bullying was happening.
Mm.
And that's just on a peer to peer. And it's very intimidating when you're an intern and you're a chief and you're like, how do I convey to this chief that he doesn't have to get intimidated by my name? That I'm not going to sit here and curse him out anytime he tells me, "Hey, go check on patient so and so." And it took months to build that relationship, to develop it, to disarm the person, right? So a lot of times
Bilbrew, yo.
bullying, you have to disarm the
Yeah.
bully.
Hey.
Still, I mean, you feeling it.
I get what you're saying, right? Because yeah, maybe you should pause, right? But
Yeah,
like, how do you? Here's the question that I got for you, and I
yeah.
think what you're saying makes a lot of sense. So how do you get your people that you're training or your mentees? How do you
Mhm.
get them? Because there's two ways that you can handle this, right? There's a pause and then you let it go, and
Yeah.
then there's a pause and then should I address it in a day or so? Like two way these are two ways in which these are going to happen, and the consequences are completely different, right? If you don't say nothing, this going to continue or it's going to get worse. If you say something, it's going to get worse, but you might get your respect. Talk us through that, yo.
So I think you should always say something. And I'm gonna give an
Mm.
example. So as I was an intern, I had a friend who was an ENT surgeon. She was from Puerto Rico, and they started making some comment about her being Mexican. And at first, she kind of went with it. That followed her all 5 years. She hated it.
Damn. Yeah.
Hated. She hated. But all
Yeah.
right, come on, little Mexican ENT, ha ha ha. And she's like,
Yeah, that's a common thing. People will confuse or a joke around someone being Puerto Rican versus Mexican
Exactly.
versus yeah.
And it's like it was a slight. So that's an example of when you don't address it. You should never not address it. I personally, I'm like, don't let a week go by, because then they're gonna be like, oh, I said that last week. What kind of, like, why are you even mentioning it? A couple, maybe at most 2 days, right? And addressing it doesn't always have to be like, hey, when you called me Lattisha Latoya the other day, that made me feel some which way. There are other indirect ways with interacting with someone to let them know, hey, there's a boundary here, right? And
Mm.
I think there's levels, there's phases to it. So like if you're at phase 15 like me, I got you from the moment you say something, I got something right back for you, right?
But you an attending though. You
And
board
that's
certified.
right.
You good. So you could come back and be like, oh,
Well, that's phase
but when
15.
you
So
but when
phase
you an
one
intern
is different.
and chief,
It's different. So that's where you do need to pause, because you have to strategize. This is
right?
just as essential a skill set as learning how to suture. Especially if
Yeah.
you're being bullied for something that you know most likely this may follow me in my career. You know, whether it's you having a certain name, a certain build, a certain gender, a certain sexual identity, you have to build that skill set of how do I deal with these bullies. And that could be when you take that time to go home and talk to your village, talk to your parents, talk to your friends, talk to your family, and say, hey, I had this situation. Gather the opinions on how to address it, coalesce them together, and then come up with a plan, right? So for me, it wasn't going back to him and saying, yeah, my name is Lattisha. I told him, hey, I'm really proud of my name. By the way, you know, but my mother named me. I'm from England. We're from Jamaican heritage. We tend to carry a lot of last names. I noticed that your last name's Greek. Can you tell me how to pronounce Chocolocolopolis? You know, and then so I'm a jokester. So I was like, you know, you got about 16 vowels in your name. How does that work? And that disarmed him to be able to be like, oh, yeah, actually.
I likes.
Right. So, like I said, you have to, with bullying, it is a strategy. When you're coming in at a level where you have to respond to someone, you're the intern, this is the attending, you're the chief, this is the attending, or even this is my co intern, right? Because sometimes it happens even at the same level. Strategize unless you have the ability to jump off. And I don't suggest you do that, because that can lead to labeling, right?
Yeah.
Like you
I
gotta,
mean, especially in a male dominated field like yours, like
right.
even if you report it up, people are gonna be like, oh, you can't handle this.
Exactly. And
She can't handle the heat.
I've been in that situation where an
Yeah. Yeah,
attendant was
it's
looking
tough.
at my hair and was
Yeah.
like, yo, your hair stinks. And I'm like, that's a macroaggression, right? So I'm
Right.
calling my program director, hey, this attending just said my hair stinks. How, he was like, well, what you using to wash your hair? That's like,
Right. Right.
we look back
Right.
now and laugh, and I'm like, oh, that's the support that I get. But
Yeah.
again,
Because they're not equipped to he's not equipped to handle that.
he
He don't
has
know what to
never
do.
even had
Yeah.
somebody have to have that be an issue, because he's never
Yeah.
had a resident with locks. He's never had an attendant comment on a resident's hair. So and that's what I'm saying, know your village. He was
And
not,
you still got to push through though, despite that though, right? Like,
despite that.
what these changes may occur in 5 years, but during those 5 years, I got to get through,
I
right? So
gotta
I
get
got you.
through it. This is my
Yeah,
second year, you know, like I'm
yeah,
like, this is
yeah.
my real
I feel
orthopedic
you.
year.
I feel
And
you.
and you know, to teach the individuals that are listening so you can learn from wisdom and not trial and error like myself, you really have to identify who your village is. You have to identify who your sponsors and your mentors are, who will understand your plight. They don't have to have the same background, gender, religion, identity as you, but they need to have the ability just to listen first, to be like, let me just hear what you're saying. I don't have a solution yet, but let me hear you out, right? Because again, it's just strategizing when you're dealing with these bullies.
Now I got a question for you. Let me start by saying, okay, so what I have down as bullying and medical training is harassment, right? Intimidation,
Correct.
excessive workloads,
Yeah.
right? So like, why am I always? How come I never got a golden weekend in like in 9 months, right?
Right.
Or like, why am I always on call? All X, Y, and Z, right? Every
Right.
holiday I'm on call. Come on, yo, stop
Right.
playing. Verbal abuse,
Mm,
being excluded. Don't talk to that person. We not. Hey, I'm gonna talk to this person to talk to that person to talk to the person who I got an issue who I'm trying to intimidate, right?
right.
But here's one thing: you talk about strategizing. What is the difference between constructive criticism, right? What if they like? What if, for example, from the standpoint of how they're correcting you, right?
Yeah.
How do you differentiate between, yo, this person is just being constructive, like they hit me at a point where, yeah, they might be right, versus, yo, you straight up mistreating me. Like,
Correct.
let's talk.
Correct.
Take
Uh,
us through that.
I think that this is so your residency is meant to train you how to be a better physician, whatever that may
Right.
be. So if you keep that as the grand scope of things, anything outside of your training, i.e., commenting on your hair, commenting on what you do for fun on the weekends, that ain't got nothing to do with my training. The second
Hmm.
thing is I tell people focus on the objective. And sometimes you have to help the attendings to focus on the objectives. I'll use an example, and I love this one. I was like a third year or fourth year, and I was doing a hip replacement where really the attending was just watching and, they're helping to retract. And at the end, hey, how did I do? I think you were awkward. Sir, I think you operate awkwardly. I think it's just awkward. So then I had to break down what was my surgical time. Was it appropriate for this? Yes. Okay. Tourniquet time appropriate? Yes. Was there excessive blood loss? No. Were the components in the right place? No. So when I finished going through all the objective things that are used, I said, so can you help me? What is awkward? Stutter. So, for the medical students, the residents, the fellows, you want to focus on the objective of is what they're saying having an effect on how you are operating,
Damn,
seeing
Dr.
patients,
Bilbrew, yo, she cooking.
presenting
Oh,
patients
snap.
out. Yo,
I love this.
listen, this is what happens.
Yo,
Y'all learn from wisdom and not my trial and error. I had to
I
go
love
through
this. Okay.
things.
Okay.
But yeah, when
Because
you
this going to happen. This is going to happen because
it's
people, there's going to be times where you're going to get a bad report or a bad review. And you be like, hey, I don't understand this. Come on. You
right.
know?
And as you know, like residency really is based on how someone thinks you're doing. And as much
Hmm.
as ACGME has shifted to try and have really specific guidelines, I always tell my mentees, you keep your own look at me book. After every surgery, you need to find your chief or your attending and you go through, hey, what was my time like? What was my blood loss like? How well did I fix whatever you're trying to fix? What did you think of my technique? Even if you have to form your own scale, and then you have to keep that as a log so that they're not just turning around and saying, well, I don't know. I just think he's okay. Well, how can you say you think I'm okay when for the last 6 weeks, every time I meet with you at the end of the week or on a biweekly basis and we go through things, you said I'm doing good. And oh, look, you signed it right here. I'm so serious. Like, especially when you're in a position where you feel like I'm being harassed here. Cause it can be so low key that you don't know if it's harassment or if it's a personality thing or if like, man, maybe I really am struggling. Go back to the objective data.